Welcome, everyone. Welcome to Facebook Live. I'm so excited for this Facebook Live because I have the best guest ever. I'm being joined by my good friend, Heidi Stevens, who I have to say,
Lauren, I think you muted.
I was muted. I'm going to start. Thank you.
Say all the nice things about me again.
I'll say those nice things again. I'm so excited for this Facebook Live, and I'm so excited to welcome Heidi Stevens because not only is she a friend, and we've known each other for years, but every morning when I open my Tribune, and I do open my Tribune every morning, that is always the first column that I read because Heidi, I have to just admit, I wish I'd written most of those columns. They're so good. And I really do look forward to it. So thank you for joining me. And I think this is a topic that we have a lot to talk about.
Yes. Oh my gosh. Thank you for asking me. Am I echoing to you?
No, I think you're okay.
Okay, perfect. No, this is such an important book. Thank you for writing it. And thank you for asking me to talk about it. I feel like it's safe to say that women don't often get the vocabulary, the permission, the modeling to talk about their bodies in general and specifically about sex and whether their bodies are doing what they need them to do in order to enjoy sex, in order to physically have sex. And so the sort of lack of those conversations just gets worse and worse and worse the older you get, right? I mean, we've all seen the Amy Schumer, last fuckable year video, right? After 42, it's like, it's over.
And you've written about, sex ed and the problems we have in sexual education and how it differs for boys and girls, and even starting at a very young age. We've got two really big problems. Number one is, as you said, people don't have the language. I mean, so often when women are talking about their vaginas, they're really talking about their vulvas. So they haven't even gotten the vocabulary right. But then when you look at sex education and what young girls are taught, it's really all about, yes, the mechanics of having sex, and it's about preventing pregnancy, contraception, what happens when you get pregnant. No one ever talks about pleasure, ever. And guys have this expectation that sex has to do with pleasure, and women don't. So that as they go through the years, if they're not having pleasure, if they're not able to have an orgasm, if things do go the wrong direction as they enter perimenopause and menopause, they don't even know where to begin to talk about it and to get information.
Right. Or whether they should even be talking about it or seeking information, right? Because maybe that's just a thing that isn't going to be part of their life. And it's not.
You know what? It's sad, but I cannot tell you how many women who come to see us in the Center for Sexual Medicine in Northwestern and what they've been told by their doctors, when they go to their doctor and say, sex hurts. It feels like sandpaper in there. It's just not going to happen. And their doctors literally say to them, this is what happens when you get old. I mean, can you imagine if every guy, this is how I start off my book, but can you imagine if every guy woke up on his 50th birthday and he was having hot flashes and his penis was the size of a breakfast sausage and he was not able to have sex and he was going to lose his job because he couldn't get any decent sleep. Right. His doctor wouldn't say to him, this is just a normal part of aging. He would be given solutions. So we have this disparity between the men and the women, not only in sexual health, but just aging.
Aging, exactly. And I love the way in the beginning of the book, you have you talk about how sort of the marketing, rebranding of impotent, right, into ED. And you have the female version. You've come up with a phrase for the female version of ED. Talk about that.
Well, so it's, as many people know, especially depending on the age of the people who are listening, it used to be that a guy who couldn't maintain an erection was known as being impotent. I mean, who wants to be impotent, weak, ineffectual? Nobody's attracted to the impotent guy. And then the guy who had impotency morphed into the guy with erectile dysfunction. Who popularized this term? The makers of Viagra, because they wanted men to be able to proudly say, my penis isn't functional and I need some help. So they go to their doctor and they would get help. Women, on the other hand, they don't even know what to call it when they have vaginal dryness and irritation and thinning and they're not able to have intercourse. And the medical word for it used to be vulvovaginal atrophy. I mean, who wants to have that? The new terminology is actually genital urinary syndrome of menopause, which we can talk about a little bit. It's far more descriptive, but
I can't remember that.
No woman's I'm yet to have a woman who arrives in our office and says, "Hi, I have genital urinary syndrome of menopause. Can you help me, please?" They don't say that. They say, sex hurts like hell. They say, I constantly have to go to the bathroom. Something's not right. And so I had tried to coin a term that would be easy for women to use. The term I came up with was GD. There's ED. I thought we would have GD for genital dryness, and it never really caught on. It never really caught on. So, basically I don't use the word atrophy. It's a terrible thing to say. Your vagina is atrophic. It's wasted. It's drying up. I tend to just basically call it by its descriptive terms. Women experience vaginal dryness and thinning as they go through perimenopause and menopause. And we're talking not every woman, but 70%. And one of the other things when we talk about language, because language is so important, as a writer, you know better than anyone how important. I always say you don't go through menopause. Because when people say they go through menopause, it's like they enter and then they leave menopause.
Oh, sure.
You never leave menopause. People say, when am I going to be done with menopause? When you die. So you enter menopause because menopause is when your ovaries are no longer making estrogen. And the point being that a lot of people think when their hot flashes go away, which we can talk about that lasts a lot longer than most people think, but then they think they're done. No, the other issues, the vaginal issues, the vulvar issues, the urinary issues, the bone loss, the cardiac, all of these things are lifelong issues and no one's talking about it.
Okay, two things. Well, three things. One, you're talking about it, so thank you for being a pioneer. Two, let's talk about the timeline, because you write in the book that the average, now it's important to say average, because that doesn't mean everyone, average age that women stop menstruating is 52. That people, I should say, stop menstruating, because some don't define themselves as women, at age 52. But vaginal changes can start as early as 40.
Right. Well, so when we talk about early menopause and premature menopause and all that, and I do define these terms in the book because it is confusing, but as you said, it's the average age when women start to go into that period of time in their life when their ovaries are no longer producing estrogen. But it is normal. It is normal for it to occur anytime after the age of 40. And it's very typical that women in their mid-40s are starting to experience these changes. And they're like, are you kidding? I'm like, I feel like I'm 20. Women who are 44, 45, sometimes they go from having a baby to going through perimenopause, and they're completely blindsided because they don't even expect that. The other group that you never want to forget about are the women that enter menopause early because of chemotherapy, maybe surgery, women who have endometriosis. There are so many young women that are experiencing these changes, and they really feel isolated, because no one is talking to them.
Right. Okay, so the third thing I was just going to say is that your book focuses on the sexual health aspect of menopause, right? It's not really about...
Actually, let me extrapolate on that a little bit, because I really wanted this book and all the books it's a part of a series, which we can talk about a little bit. But yes, the sexual part of it's important, but this book is also for women who really aren't interested in sex, or maybe they're not having sexual problems, or they don't really care. And when we define sex, let's be honest, sex means a lot of things. Sex can be intercourse with a penis or with a toy. Sex can be all kinds of other things. Certainly gay women don't care about having intercourse, and they're very sexual and have these same kind of problems. So while we are looking at sexual issues, there are a lot of non-sexual issues that fall under the umbrella of the term I used earlier, this genital urinary syndrome of menopause. So a lot of women, the only symptom they may have is they keep getting urinary tract infections, and no one has told them that this is menopause and this is so easy to fix. Or women that have that gotta go feeling, that urgency, that constantly, oh my God, where's the bathroom? This is a result of menopause. So there's, vulvar irritation and sometimes infection. So yes, to your point, I do talk about the sexual issues, but I feel like I spend equal time talking about the non-sexual issues.
No, you do. That's a good point. So let's stay on urinary tract infections.
Yeah.
Since you brought them up. I don't think a lot of people know that
No.
can be a symptom of menopause or a side effect. I certainly didn't.
Yeah.
So what do you do about that?
Well, so the thing is what people don't appreciate is that you have estrogen receptors, not just in the vulva and the vagina, but also in the urinary tract. So what happens is women go through menopause and the vaginal walls get thin and dry, and we talk about that all the time. But you also see anatomic changes in the urinary tract, which makes women more prone to getting an accumulation of bacteria. There's a change in what we call the microbiome, which is the population with healthy bacteria. And this all changes so that women start to get a lot of recurrent urinary tract infections. And the typical scenario is that she'll go to her doctor, who will give her an antibiotic, and then she'll get a yeast infection, and then she'll have to treat the yeast, and then she'll get a bunch of urinary tract infections. So then she'll be sent to a urologist who will do a cystoscopy. And, it's down this slippery slope. And then when they finally make it to someone who really understands that this is part of menopause, sometimes it's as simple as putting a little estrogen cream on the urethra, and boom, the problem is gone. Mm-hmm. And there are things that we can also offer women. A lot of times this strikes women who are significantly older, in their 70s and 80s, and they're not comfortable necessarily putting something on their vulva or on the urethra. There's pills that we can give people that address these issues. So there's so many solutions that we can offer women that no one should be having these difficulties.
And a lot of the solutions that we're told by, a girlfriend or Glamour magazine or something, you spell out in your in your book as not actually effective, right? I mean, don't think cranberry juice is going to stop you from getting UTIs.
No, it does not. I mean, it's so many myths out there. And every once in a while when I'm talking to editors in magazines and they're like, let's do another myth and truth article. And I'm thinking, okay, again, but the truth of the matter is that we need to keep doing them because there are so many myths out there. I mean, even things like that using a local vaginal estrogen product to help alleviate these symptoms, whether it's a cream or a pill or a ring, and there's all kinds of options out there, that this is somehow going to cause cancer or that it's going to cause other problems, when in fact there really aren't any side effects from these products, and any woman can use them, even women with breast cancer. Big myth that they can't use them. Okay. And these products, you go to your doctor and they don't even tell you about them. And I also and I say this in the book, but I'm going to say this now, I was not paid by anyone. There's a lot of products in there. I go through every single FDA approved product so that I can explain the differences and the pros and the cons so that women know what they have to choose from. No one paid to be in the book. I have no sponsors. And I did that very specifically because I didn't want anyone to think that my information was anything other than, balance. And I do cover every single product.
Yeah, no, it's so helpful. Okay, so speaking of products, let's pretend we're visiting the drugstore together, because I think that often the first thing you think to do when you start noticing changes is like, maybe something's not clean enough, or maybe there's some product I haven't tried, and I'm going to go to Walgreens and see what's out there. What should you not go buy and stick in a place where you think things have suddenly started looking or smelling or feeling a little different?
Exactly. Well, I do have a chapter in my book called A Walk Down the Feminine Hygiene Aisle. And a little piece of trivia, the term feminine hygiene actually never had anything to do with being clean or smelling good or
being feminine.
No, it was when back in the early 1900s, the Comstock Act, when it was illegal to sell contraception publicly. And so this was kind of a euphemism for being able to sell contraception, as they just said feminine hygiene, when in fact it was contraceptives. But this has morphed into this multi-gazillion dollar business of, quite frankly, entrepreneurial types just feeding on this notion that women, as we talked about earlier, feel that their genitals are not clean, that they're not, that they're dirty, that they have to smell like, perfume. And so they have all of these products for women to buy to cover up the offensive odor, and these vulvar washes. And I don't remember if I put this in the book or not. You kind of like weed through what you put in, what you don't put in. But one of the things I did was I Googled, I went to Amazon and I put in vaginal odor. and like 9 gazillion products popped up. And then I put
this in there.
Penis odor or whatever.
Yeah, you put that in there.
Nothing. I
Right.
think there's one I called smelly balls or something.
Yeah.
But the point is that women truly believe that they have to wash their vulvas, and you don't wash your vagina because it's inside, but wash your vulva with a special rinse or a special wash. And the truth is not only is it unnecessary, but many of these products are actually irritating and can create a great deal of damage. So, skip that part of the feminine hygiene. When you go to the feminine hygiene, don't go to any of these vulvar washes. Yeah. They're all bad for you. But the other product that women tend to go for is lubricants. Yeah. Because the first thing that happens when women first experience what I call sandpaper sex is they're thinking, okay, I'm going to go find a lubricant. And they, first they usually exhaust what's in their medicine cabinet at home, the baby oil and the Vaseline, which has its own problems. And then they head on down to the kitchen and go for the coconut oil and all these other oils, which also are not the best choice. And then when they finally do get to the drugstore, it's overwhelming because there's shelves and shelves and shelves of stuff and women don't know what to get. So they grab the first thing, throw it in their basket and then run before they run into anybody they know. Mm-hmm. And unfortunately, the overwhelming number of vaginal lubricants that are out there are not only not good, but they can actually be damaging to vaginal tissue. And that
was so interesting to me. I don't mean to interrupt you, but that chapter really surprised me. Which ones you should veer toward and which ones you should avoid. So keep talking.
Yeah, no, and in fact, that's one of the chapters. I was always trying to balance. You don't want to get too sciencey, but on the other hand, I think women are smart enough to understand this, and I want to give good, accurate information.
Right. Well, I would have thought water-based sounds like. That seems kind of natural. I think I'd rather put water on my parts than silicone, but.
Right, except think about this. If you put water on your hands and then you rub them together for a long time, what happens? Your hands get all gritty and sticky, right?
Oh, I don't know.
But then they do. Try it.
Okay. I trust you. You're a doctor.
And it's super slippery. And what people forget is that what a lubricant does is it decreases friction. It doesn't actually change the tissue. It just makes it more slippery. So the water-based lubes, not only are they not all that slippery, especially over time, but they have a lot of additives in them to try and make them more slippery that increase what's called the osmolality, which can cause tissue to become dehydrated and damaged. So in general, you're actually much better off with silicone-based lubricants. And I go through all of this and actually list them. That's why I wanted to put products in this book. Right. So people would actually know what to go and buy, so that when they did walk down the aisle, they're not just grabbing the first thing. And I'll just say this because, they already know that I say negative things about them. But KY jelly is probably the worst thing you could put in your vagina or in anyone's vagina. It is just toxic. Over time. It has a sky-high osmolality. It actually dehydrates and breaks down tissue. There are some water-based lubricants that are fine to use that have been really designed to have a lower osmolality, and they're fine. They're not often as slippery. But these are the kinds of things that are just so confusing because no one, when you go to the doctor, they just say, go get a lubricant. They don't tell you what kind.
Your doctor even tells you that.
A goodie bag of lubricants. I'm actually doing a giveaway on Instagram tomorrow of a book and a bag full of my favorite silicone lube. So if you're not following me on Instagram, follow me on Instagram to get the lube giveaway.
That's a good idea. So you tell people to spring for, even if it's a little more expensive, spring for the silicone-based stuff. Okay.
Absolutely. And the truth is it seems like it's more expensive, but it's really not because you end up using a lot less.
Okay. I want to leave time for questions, but I also want to ask, when do you think that women become good candidates for vaginal estrogen? Like what age, what are your symptoms?
Yeah, so just to drill it down, when you look at lubricants don't change the tissue. But for a lot of women who just have mild changes, that's enough. They just need to get something slippery in there. They just need to decrease the friction. Mm-hmm. If that's not doing it, if despite using a really good silicone lubricant, someone is still having pain and dryness, then it's time to go to the prescription products. And there are a lot of prescription products out there, certainly the local vaginal estrogens, but those are not the only ones. And it was really important to me in this book addressing the fact that while I maintain that local vaginal estrogen is safe and that any woman is a good candidate, there are many women who, for a variety of reasons, just prefer not to use an estrogen or have been told they should use an estrogen. So I spend equal time talking about non-estrogen options that also work very, very well. But the mantra is no woman should have pain with intercourse ever. I cannot tell you how many women just say, okay, I'm going to grit my teeth and put up with it, even though I'm not only not having pleasure, but I'm actually having pain. And part of it is because they don't want to admit to their partners that something has changed, that they're getting older. And one of the things, and I think I saw something in the comment box I'd like to get is the whole idea of including if you have a partner, a male partner, a female partner, your partner needs to know what's going on.
Right.
Needs to understand that if you're cleaning out the refrigerator at 2:00 in the morning and avoiding sex, it's not because you don't like your partner, it's because you are in avoidance mode because it hurts so much. So we need to have this conversation, not just with the women, but with the other important people in our lives as well.
Right. And I love your character, Francie, because, and you can talk about that for a second if you want to, but you have this character who pops up throughout the book and she's going through these dating scenarios or, she's getting mansplained here and there, but like a lot of it is around what partners say about products or about like, is something wrong with you if you're dry?
Right, like one of Francie's, date says something like, are you kidding? I thought only old people needed a lubricant, and that kind of thing. And so the character of Francie, we always say menopause can be dry. So I was trying to make it a little bit more interesting. And as I mentioned, it's a series. So this first book is Slip Sliding Away, Turning Back the Clock on Your Vagina, which is about these vaginal, vulvar, urinary changes. In the second book, it's hot flashes. Third book is going to be, I think, dating. Fourth book, I've got 8 or 9 books planned, and we're going to, you name it, we're going to cover it. And poor Francie, who is basically, she is the embodiment of every menopause woman. You name it, it's going to happen to Francie. So in this first book, she gets recurrent urinary tract infections, and she has dryness and pain with intercourse and urgency and all that stuff. In the next book, she literally practically is going to lose her job from her, horrible hot flashes, the fact that she can't remember why she walked in the room. And then Francie's going to get cancer. I haven't decided what kind of cancer yet, but she will get cancer because that's going to be probably the fourth book. But the point is that I wanted, I've been doing this so long, and I run a menopause clinic, and I learned so much from women who've come to see me over the years. And what I was really thinking about when I wrote these books is I want this book to be like a consultation with me. So I wanted there to be like a person that I was actually offering this advice to. So I made up Francie, who's the conglomeration of a lot of the women I've worked with over the years. And I'm hoping she adds a little lightness and a little fun. If for people who are on at the beginning of the video, that's my dancing Francie at the beginning.
I love it.
Wonderful artist who worked with me on the Francie figure. And I'm hoping that makes it something that people will really, really identify with.
For sure. I think it does. I think it will. I should have reminded people, if you have questions, just put them in the comments, right?
Are you able to see them, Heidi? Can you see them?
I think so. Yeah, I'm seeing stuff pour in, but I'm seeing a lot of comments, but not so much questions. So if people have questions, we'd love to, I'll throw them to Dr. Streicher if you have them. Otherwise, we'll just keep talking too. But I do also want to add, before we get to questions, talk a little bit about vaginal lasering.
Yeah, so when we talk about some of the non-hormonal options, there's a laser procedure that I do. It's a CO2 laser. It's called the Mona Lisa Touch, and I have a very, very large laser program at Northwestern. There's only a few of us actually in the city that are doing this. And basically, this is a non-pharmaceutical, non-hormonal way to reverse the vaginal thinning and dryness. So basically, I think people are very familiar with using laser on your face and to remove tattoos. And one of the things that laser does is it actually increases blood flow. It increases collagen, which is why it works so well for wrinkles. But it turns out that in the vagina, and it is a little bit different. We can't use the laser in the office on our faces. It would be kind of fun, but we can't do that. But essentially what it does is it resurfaces the vaginal walls so that if I look, and I show a microscopic picture in the book, if you look microscopically at a vaginal wall post-laser, you can't differentiate it from a 20-year-old. It really restores normal vaginal lubrication. and elasticity and enables women to have pain-free intercourse. So I do have a chapter on laser because I think people need to know that it's an option. It works very, very well. Unfortunately, it is not covered by insurance. I have a program that I started at Northwestern about a year ago called the Brava program, where I got some very generous donors to donate significant amounts of money specifically for women who have a history of breast cancer so that they can get laser procedures for free. So, because this is a group that very often is told they can't use vaginal estrogen, and they're so often, these are young women, you know.
Yeah.
But any age woman who's had a breast cancer diagnosis, either current or remote, who's interested in laser, who's not able to afford it, if you go to our website, sexmedmenopause.nm.org, and you
Wait, say that again.
sexmedmenopause.nm.org,
Okay.
and I'll make a banner for that so that we can, let me put that up there. But essentially, there's a tab that says the Brava program, and I'm looking down so I can just type this in. Okay, there it is. There, sexmedmenopause.nm.org is the website where you get a lot of information about the Center for Sexual Medicine and Menopause at Northwestern, but very specifically, we do have this really wonderful Brava program for laser. And not to be confused, I always say you don't want to go to your plastic surgeon and have you know, him or her laser you or radio frequency. There's all these other things out there that are not the same. This is a medical procedure to treat a medical condition. This is the term that makes me crazy is vaginal rejuvenation. We do not rejuvenate our vaginas. We treat the things that have caused our vaginas to not be as functional as they should be. You know, but we're very excited about our laser program at Northwestern.
Okay, good. I'm glad you told us about that. So let's throw it to questions. Elaine wants to know, why do we still think estrogen options cause cancer?
Yeah, Elaine, this is $1 million question that comes up again and again. So 20 years ago, there was a huge study that came out, the Women's Health Initiative, that they said that women who took estrogen for more than 5 years had a slight increased risk of breast cancer. And what we now know, and I'm going to get into this in real detail in my next book on hot flashes, but what we now know is that there were a lot of problems with that study, starting with most of the women were over the age of 65 in that study, that these women very often had other medical problems. And in fact, if you looked at the estrogen-only group, women that, you know, we usually give a progesterone along with estrogen to protect the uterus. And if you looked at the estrogen-only group, not only do they not have an increase in breast cancer, but they actually had a decrease, and a 30% decrease in all-cause death rates. So this, you know, and a lot of people think it's my opinion that estrogen doesn't cause breast cancer. No, it's not my opinion. We know this from the scientific studies. The menopause experts know this and understand this, but this message continues to get out there. But then the other thing that makes it even more complicated is that the FDA has something called class labeling. So that means that if they say that the systemic estrogen that was taken back then in pill form, which I don't even prescribe that particular estrogen anymore, but that particular estrogen cause problems like an increase in blood clots, which it can, and then there's an association with some other medical issues. So then when the vaginal estrogens came out, the FDA insisted on putting all of the same warnings on the vaginal estrogen, even though there's not one single study, that shows vaginal estrogen increases the risk of any kind of cancer at all, causes blood clots, causes dementia. All of those things that are listed on the label do not occur from vaginal estrogen. And there's been a real push on the part of menopause experts to get that labeling removed because so many women are afraid and they stay away from it when in fact none of those things are the case. So it's a real PR problem, if you will. And then the other thing that doesn't help is, quite frankly, most doctors don't even know. You know, there's so few menopause experts, and so many women will go to their internist or to a family practice doctor, even their gynecologist, and they're told you can't use this product because you have breast cancer, or you have breast cancer in your family, when in fact every single scientific study we have shows that not only does it not increase it, but it doesn't cause any problems at all.
Okay, that seems hugely helpful. Thank you for explaining that. Gigi wants to know, what do you think about Vagifem?
So Vagifem is one of the products that I use, that I talk about in the book. Vagifem is an estradiol. All of the vaginal estrogens are beta estradiols that are plant-derived, and Vagifem is one of the products that's about the size of a little aspirin, and there's a little inserter that you put the Vagifem in the vagina. And the thing about Vagifem that's interesting is it's a perfectly good product, but it really does a great job of treating the inside, the vagina. It doesn't do a great job of treating the opening to the vagina. And a lot of women use Vagifem and continue to have pain, and they think the Vagifem's not working, when in fact the Vagifem is working, it's just not working in the right place. And I always say it doesn't matter how nice the room is if you can't get through the door. So we have to then focus on products that are not only going to treat the vagina, but will also treat the opening of the vagina, which is called the vestibule. So in answer to Gigi's question, is Vagifem a good product? For some women, it's a terrific product. It does come in generic now, but for other women, it just doesn't do it for them, which is, again, why I can, talk about these products and tell everybody the pros and the cons. At the end of the day, we have to individualize this treatment, and women, do need to see someone who can help them.
Yeah. Yep. Good point. Okay. Is decreased libido associated with painful intercourse?
Your vagina's not stupid, and if something hurts, your vagina's going to say to your brain, "Don't go in there. Don't do that." So yes, and in fact, when someone comes to the center and they say that their primary reason for coming to the center is that they have no libido. So the first question we ask is, when was the last time you had sex? Oh, about 6 months ago. How did it go? Well, it hurt like hell. Well, no wonder you don't want to have sex if it hurts like hell. So our approach is first we eliminate pain. As I said before, no woman should have pain. And then once we eliminate the pain, then we circle back and say, how's your libido now? And a lot of times they'll say, you know what, now I'm okay. Or they'll say, no, I'm still having libido issues, which is book 5, when Francie loses not only her libido, but loses her ability to have an orgasm. And so we see, when we look at sexual dysfunction, and loss of libido is the most common thing that women have, going on as far as the inability to have a normal sexual response. So, but the good news is this is something that we treat, that there are solutions. And I think that's my number one message, is that whatever difficulty you're having, whether it's, hot flashes or dryness or urinary tract issues, these are treatable. There are solutions. And too many women just feel like if they weren't given the solution, that the solution doesn't exist. And that's why with this series, I wanted to make it so solution oriented. And I've also discovered from my work at the clinic that, when women come to the clinic and they fill out this questionnaire of every symptom they're having, and most women have 30 or 40 symptoms. But then we ask the last question, which is the most important question, and that's, what's bothering you the most? If you could only fix one thing, what would it be? And very often they'll say, oh, it's the hot flashes, or I'm gaining weight, or it's the vaginal, pain, or whatever. But that's why when I was writing this series, I thought people don't want to wade through a 500-page book on menopause. They want to know how to fix their problem. Yeah. So my goal is that, and I made these books very inexpensive. It's $3.99 on Amazon to download it. And the idea being that if vaginal issues are your issue, then you're going to get that book. If it's hot flashes, you're going to get that book, or you might end up getting all the books. But it's targeted. It's targeted.
I love that. I also feel like this is a good time to bring up that you say in the book that use it or lose it is kind of true in this. Yeah. On this topic, right?
Well, I always say fix it and then use it or lose it. Because a lot of women who are having pain, they think if they just start having sex, the pain's going to go away and it's going to get worse. And which also brings me, I see Gina said, and because this is on the same topic, she said she tried estrogen cream and it had zero impacts. And obviously, Gail, I don't know what was going on with you because I haven't examined you, but I will tell you there are so many women who are given an estrogen product, whether it's a cream or a tablet or a ring or whatever, and they continue to have pain. And the reason that they continue to have pain is because there's two components to having pain-free sex. One is the tissue, which can get thin and dry, but the other are the pelvic floor muscles. And a lot of times when women have had painful sex, their pelvic floor muscles go into keep out mode, so that we have to treat not only the tissue, but we also have to treat the muscles, which are tight and painful. So I don't know if that's the problem with you, Gail, but so often we see women that come to the clinic and say, it's not working, I'm using the estrogen, or I did the laser, I did this, I did that. And then we actually sign them up for pelvic floor physical therapy, and that alleviates the problem. But again, to your point of use it or lose it, what we find is that women who are not having pain, but are having intercourse on a regular basis, that does help in terms of the elasticity of the tissues. It helps to keep the muscles relaxed and functional. And not everyone has a penis in their life all the time or even wants to. And we also, we talk about toys and the fact that a lot of women, that when they're self-pleasuring, when they're masturbating, a lot of times, to have an orgasm, of course, they're using external stimulation. But that if someone is interested in penetrative sex, and if there isn't a man in your life, that's where Bob comes in. And then Bob, of course, is your battery-operated boyfriend who's always good to go. Very low maintenance. We love Bob. Bob's a good one.
Yeah, Bob's a keeper.
Bob's a keeper.
Yeah. So Lizzie said, I was surprised what a mental toll all these changes created. Can you talk about that a little bit?
Oh, what a mental toll. Well, absolutely. This has actually been very well studied, that when you look at any of these symptoms, whether it's the vaginal symptoms, the hot flashes, the stress and anxiety that comes with this is predictable. I mean, who wouldn't be stressed and anxious and depressed about these changes that occur, which impact not only on your own ability to be functional and self-esteem, but also in relationships. And I don't mean just your partner or your spouse. I'm talking about relationships with your friends, with your coworkers, with your family, because when you're not feeling well, it's going to take a toll on everything. And a lot of women will go to their doctors and they're like, okay, I'm anxious, I'm not feeling good. And the doctor, instead of getting to the root cause, will give them an antidepressant, which in some cases, is certainly the way to go. But for a lot of women, it's really the menopause symptoms that are causing the anxiety. And then they get an antidepressant, which, makes them lose their libido, their ability to have an orgasm. And then they gain weight. And it's like, are you kidding? So we address that. And one of the things I often talk about is that I'm a gynecologist, I'm not a therapist. And I deal with the physical, medical, and hormonal aspects of menopause and sexual response. But that doesn't mean that I'm minimizing the impact on relationship and psychologically, which is why we work so closely with therapists in our center at Northwestern, the Center for Sexual Medicine and Menopause. We have to hire more therapists because they are so busy. Because even if you don't start out having those issues, if you have dry, painful sex and hot flashes long enough, you're going to have those issues.
Sure.
So we work together.
Yeah, absolutely. Okay, maybe we'll do one more question. Is that okay?
Sure.
Okay. Are there other insertable pills than Vagifem that treat both the opening and the room?
The room, yes, there are. And sometimes we do what's called dual treatment. Like someone may use a Vagifem on the inside and we might use a cream on the outside. In slip sliding away, I also talk about Dhea Suppositories, which are phenomenal. DHEA is the building block for estrogen and testosterone, because we do have testosterone receptors in the vagina as well. So that's the thing is again, my mantra. So many women, when they go to the doctor, and very often the doctor will just offer them one product and they don't know that there are choices. And women can't always find a menopause expert. So my goal is when you read the book and you see all the products and I show pictures of them and the pros and the cons, so that you can go to your doctor and say, I don't know that Vagifem is the best option for me. I've read about this other product and I would like to try that as well. And when we have women that come to the center, some things are really hard to fix. Like sometimes orgasm isn't always easy if someone's having problems, or libido. Vaginal dryness we can always fix that. I mean, basically 100% of the time, because we have so many products available to us, and it's just a matter of knowing which ones are the right ones for each woman.
Yeah. Okay, I do want to ask Lizzie's question. How do we find our own local version of Dr. Streicher? Do you have an answer for that?
Yes, I do, because
read your book?
I speak nationally, and certainly in Chicago, I want everyone to come to the Center for Sexual Medicine and Menopause. But there is a website which is called menopause.org. Menopause.org, and this is the North American Menopause Society, which is basically the society that all the menopause experts belong to. And if you go to menopause.org and you go to the top tab that says find a practitioner, and you put your zip code in, and you will find certified menopause practitioners in your area. And certification is not easy. This means that this person really does know something about menopause. And it's, unless you live in a really small town, you'd be surprised. They are out there. Sometimes it's not a physician. Sometimes it's an advanced practice nurse or a physician assistant. We have to keep in mind that an MD is not always required to get expert advice and to learn what you need to know. There is a chapter in my book called Finding Your Vagina Team, which is exactly that. Kind of gets into the nitty gritty of how do you find someone who knows what they're doing, because women are so frustrated that they might have an otherwise really good doctor or even a gynecologist who just doesn't know anything about this stuff.
Right. And you point out in the book that it doesn't necessarily have to be a female doctor.
No, it's interesting because there's this whole idea of only someone who has a vagina is going to be able to help me fix my vagina. And the truth is, it's kind of like saying that if you have an appendectomy, that if your doctor didn't have an appendectomy, that he or she shouldn't be doing yours. Someone who's an expert is an expert. And some of the best experts in the country happen to be men. And quite frankly, there are plenty of women gynecologists who are clueless when it comes to this. So what I can't argue with is people's comfort level. And, a lot of women are just more comfortable seeing a woman doctor. But if the only menopause practitioner in your area is a guy, give him a chance, because these men, some of the best experts in the country are my male colleagues. Mm-hmm. Really good.
Awesome. Okay. So I want to close out with my friend Lisa. Her comment is, I feel like every woman should buy your book and one to give for her friend, sister, daughter, mother who is too scared. I think that's really hits on so many important points, right?
Thank you, Lisa. And that's also, I wanted it to be accessible. That's why I priced it really low. I'm hoping that this is something that people will not only get for themselves, but to give to others. And, I'd love to do book clubs. I want to talk about this stuff. And while the pandemic, and we won't even get into that, how bad it's been for so many things, but one of the things that's been good is actually having these kinds of conversations, because when I released my last book, all of the book events I did were in-person events. And I feel like now I can reach so many more people doing these kinds of conversations, which is why, Heidi, I'm so grateful to you for agreeing to do this. And actually, I'm going to be doing a series of these. In fact, I have an interesting one. I'll just preview of upcoming attractions. On Wednesday, I'm doing a Facebook Live with, believe it or not, my first cousin that I did not know was my first cousin until we discovered each other on Ancestry.com DNA a few months ago. And she's like my clone. She looks like my twin. It was a child that was placed for adoption in my family. So we're going to tell that story too, and then talk about menopause. So, but that's the beauty of this. Is she's in Indiana, so we'll be talking, I hope, to Indiana women.
That's awesome. Thank you so much for inviting me to be part of this. I'm going to
pull up my social media stuff so people can take a look at that. And Heidi, thank you so much. And for bringing your wisdom and your just willingness to talk about this. And I hope that we have a chance to do this again and keep the conversation going.
Me too. Anytime.